Hello everyone, this is Dr. Dmytro here, and today I have a clinical case report to share with you. This time, the subject of the case report is me, myself. The medical history goes like this. Since about 3 weeks ago, I have developed pain in the right shoulder joint that was much aggravated with movement in the right shoulder and significantly reduced the range of motion in my right shoulder joint and right arm. At the initial stage, the pain and swelling were generalized over the entire right shoulder, arm and trapezoid area and was associated with general fatigue, muscle pain and stiffness, poor quality sleep, and me being generally unwell. Clearly, these were the symptoms of overtraining. When I analyzed what could cause that, it turned out that a week before the symptoms occurred, I was traveling for work and conference overseas. Actually, it was in Hong Kong. As usual, I was staying at the hotel, and as usual, I was still following my diet plan and exercise routine. I was training at the hotel gym, doing my morning fasted cardio and evening resistance trainings, just as usual. Unfortunately, most of the hotels are not equipped with full-range gym equipment, and the hotel where I stayed had only a variety of cardio machines and dumbbells. So I ended up doing exercises for the deltoids and arms with free weights. And I was doing that every day, from Monday till Friday. Such heavier than usual volume of exercises involving a particular anatomical area, which also included drop sets as well, plus the age factor, not getting younger, and strict diet, lack of rest and recovery, has resulted in me developing the OTS, the Overtraining Syndrome, with right proximal biceps tendinitis and right anterior deltoid tendinitis. As the condition progressed, the symptoms became more clearly defined. The pain in the shoulder area with difficulty to lift the arm and hold it in a certain position, loss of mobility, clicking sound when I move the upper limb in a shoulder joint, tenderness in the front of the right shoulder and upper arm. The pain was acutely and severely aggravated by front arm raises and biceps curls. There was a visible swelling in the upper arm and shoulder, and audible clicking sound upon active abduction test. Other clinical and functional tests that are described in our recent book titled Minimally Invasive Procedures in Daily Practice of Anti-Aging and Regenerative Medicine Practitioner, such as restricted rotation test, lateral and medial rotation test, clearly indicated the peculiarity of the injury. Posterior extension of the arm, rotation of the arm, front raises and curls were extremely painful, and range of motion became significantly restricted. The symptoms of the overtraining have gradually disappeared, but the annoying shoulder pain and restricted range of motion stayed and persisted. Normally, it would take few weeks or even months to heal such injury. Of course, with a complete rest, aggressive physiotherapy, and non-steroidal anti-inflammatory medications taken both systemically and topically. Such scenario did not look attractive to me at all, and of course, driven by the motto, practice what you preach, here is what I decided to do. Just as described in our recent medical textbook, Minimally Invasive Techniques, I have decided to use a combination of biological therapeutic agents. In particular, the cocktail of biologicals included nanomized placental stem cell extracts, the nano-organopeptides from placenta, which are rich in growth factors and anti-inflammatory cytokines, body protection compound 157 with addition of thymic peptides, and exosomes. The cocktail of biologicals were administered using a landmark technique via a lateral subacromial approach and a craniocaudal approach for the proximal biceps tendon. The exact techniques of the approach are described in details in our recent book, Minimally Invasive Techniques in Daily Practice of Anti-Aging and Regenerative Medicine Practitioner. The results were very impressive and remarkable. Following the first session, I had nearly 80% reduction of pain and restored range of movement by 75% within the first 24 hours. Following the subsequent sessions, I have nearly completely restored range of arms motion and only minimal pain felt at the very terminal points of movements. either extreme supination with external rotation or extreme posterior and internal rotation of the arm. The swelling has greatly reduced and clicking sound has disappeared completely. I'm recording this video on the day 3 from the start of the treatment protocol. I'm 100% back to my regular regime, work, lifestyle, and training. I'm going to complete the studied protocol within the week, and so far, I'm absolutely positive and optimistic of the great results. Signing out from European Wellness Academy, stay healthy, be alive, and have some fun.